Hello, and a very warm welcome to our 16th Rare Revenar. I'm Nicola Miller, Editor-in-Chief and Creative Director here at Rare Revolution, and I'm supported as usual in the background by my colleague Becky Pender. The number of registrants today is a real testament to the community interest in this topic, and I'm really delighted to you all for joining us. And I'd like to encourage you to use the Q&A function, so you'll see that at the bottom of your screen, so that you can ask any questions or leave any comments for your panelists, which we'll endeavour to get to at the end. Today's session is supported by Childhood Tumour Trust with grant sponsorship from Alexion AstraZeneca. Childhood Tumour Trust are a UK-based charity who offer support and resources for living with neurofibromatosis type 1, or NF1 for short. And having worked really closely with their team over the last year to raise awareness on the increased breast cancer risk associated with NF1, I'm really excited to be visiting another topic today, and a really important one as well. I'm especially thrilled to be joined by a wonderful panel today comprising Dr. Will Evans, General Practitioner and Joint Primary Care Lead for the North East and Yorkshire Genomic Medicine Service, Sal Athey, a NF1 patient raising two children also diagnosed with NF1, Catherine Hickman, mum to a young son with NF1, and Mary Thomas, the NF lead nurse at the Nationally Commissioned Complex NF1 service based in Guy's and St Thomas's in London. Afternoon all and welcome. Thank you for joining us today. So I really want to bring to life the vital need for care coordination in NF1 today, and it's going to be a real focus. But I'd like to start today by looking at the skin manifestations, which can be a really critical clue, as we all know, for NF1 diagnosis. I want to start with you first, Will, and if you can just talk us through the possible dermatological signs of NF1 and what those skin manifestations might be.
Hi, thank you, Nicola, and hi everybody, and thanks for the opportunity to join this webinar. So I guess they're the most well-known feature, and certainly I would say most doctors are aware that when they hear of the term café au lait, they think of neurofibromatosis. But so perhaps it's useful just to describe what a café au lait macule or café au lait patch is. So that's a typically light brown coloured flat macular skin lesion, and they normally measure more than about 0.5 centimetre, but can be quite a lot bigger. And they're actually quite common. So most people who have café au lait patches do not have neurofibromatosis type 1. But as I said, they're quite common. But I think the key feature is a number of café au lait patches. So in neurofibromatosis type 1, it is part of the diagnostic criteria, the clinical criteria for the condition, but you need to have more than 6, and they have to be bigger than 0.5 centimetre in young children, and in adults or those post-puberty need to be bigger than 1.5 centimetres, so more than 6. Typically, children who have neurofibromatosis type 1 will have more than 6 by 2 or 3 years. So sometimes you do get very little children referred because their parents got has a diagnosis of neurofibromatosis type 1, and there can be some diagnostic uncertainty when they're really little, but then often children are brought back at 5 to see if they've got other clinical features. So that's probably the most well-known clinical feature. You also get a thing called axillary and groin freckling, which essentially are very small little freckles that cluster in the groins. That's another quite classical clinical feature. And then neurofibromas themselves. So these tend to occur later, so more typically kind of around puberty and after that. And these are skin lumps. So these are little benign tumours of nerve cells called neurofibromas. So you don't tend to see them in little children.
So the café au lait in most people would be that first early presentation that would come before those other presentations.
That's right, yeah, and the axillary freckling as well, which tends to occur kind of 3 to 5 years time.
And how exact is that clinical criteria? You mentioned 6 and the size. So is that a very definitive guide? Like, for example, if somebody had 5, does that preclude them from having a diagnosis? Or is there kind of a grey area around there? I know that Childhood Tumour Trust has done a lot of work in terms of getting this into health visitors and midwives so to help people with mapping that. So, but is it an exact science? What's the grey, or is there a grey area?
So the answer is, so there is as I said, there's a clinical diagnostic criteria, and there are different features that you look for. So café au lait patches are one of them, but you can have a diagnosis of neurofibromatosis without having the full set of those. Typically, people would have more than 6, but you need to have, if you have a parent, if we're talking about a child and a parent is affected, you just need to have one of these additional features. And that includes 6 or more cafe au lait patches, but also includes some changes that can be found on the eye. So if you're wondering about this, and patients are seen in a diagnostic setting, like a clinical genetic setting, often that they would always be referred to an eye doctor to look for these things called Lisch nodules. So there are other in the clinical diagnostic criteria. There are other features that you can look for in addition to the skin findings.
Thank you. And I know we're going to touch on that a little bit in the future, Mary, about the diagnostic pathway. But I want to come to you, Sal, because I know that dermatological presentation was actually how this journey started for your family. Can you share a little bit more? Because it was kind of an incidental finding as to how that all started for you.
Yeah, so my son William, he has quite a complex health picture, but one of the things that we were looking at the time was reasons for his persistent glue and hearing loss. So the audiologist at the time referred him to genetics to test for a syndrome called Bohr syndrome. So we went along to the appointment, and I remember because it was a Friday and they were due to go to a party afterwards. And we thought we'll go along and they'll, take the blood test and then we'll find out. But the geneticist took his clothes off and looked at him, and she basically categorically said, well, I definitely don't think he has Bohr syndrome, but I'm going to most definitely tell that he has NF1. Now, I went into an instant meltdown because I knew, so I had some knowledge of NF1 from having a child in my class many, many years ago. I'm a teacher with NF1. And I was kind of aware of what happens when you Google NF1. So those are kind of like the images that I had in my head. And obviously I was very upset, and she proceeded to tell me that, when you hit puberty, that he would start to develop these tumours. And I remember drawing on a piece of paper the size of the tumours. I think in an attempt to calm me down, I don't know whether she was just trying to be kind.
Yeah.
And obviously we left that appointment and went to this party. And I remember just sitting there in complete shock and not actually believing what was happening at the time. And it wasn't really until we went home and I calmed down and I said to my husband, I'm sure Isabel, our daughter, also has the cafe au lait patches and the groin freckling and the armpit freckling. So we took her clothes off, and it was very clear then that she had the same symptoms as William. And I knew from something that the geneticist had said about, it being very unusual to have 2 documented cases of random mutations in one family, that therefore it had definitely come from me because I'm covered in cafe au lait patches. I also have some growths and bumps on my body, which I've had looked at before, but was told that there was nothing to worry about, that there wasn't anything we could do. So myself and my daughter weren't diagnosed until 7 months later, because that was the nearest time that we could get to see the geneticist. But it was just a really hard time for us, and I couldn't talk about it. It took me about a year really to talk about it to anybody, and it's different now, but at the time I grieved the life we had before diagnosis, because I felt that we had this whole new life and this whole thing that we're now dealing with. And it was really, really difficult. It was a really hard time. So, but there were lots of missed opportunities. So I was seeing ophthalmology because I have a lot of problems in my eyes and my eyesight. And they were following me for freckles on my eye. They are now, that I know to be Lisch nodules. I don't know whether I'm saying that correctly. William, at many, many appointments, they used to point out what I thought were birthmarks and say, how long has he had these? You need to keep an eye on them, but nobody explained why. And it wasn't until recently that we discovered that somebody had actually written in his notes and queried NF1 a long time ago, but it was never actually followed up. And, William's seen by lots of different people. So, he was presenting as having ADHD and ADHD. He had a large head. He had short stature. So all the signs were there, but they were missed.
Yeah. So
Um,
quite a frustrating time for you then, because not only when you sort of processed it, the realization that things had been missed, but also what an abrupt diagnosis to go
yeah,
from, your son, but then actually later that day realizing that probably meant three of you, and also
yeah,
I guess kind of to be have that news delivered so abruptly there and then without any need for further testing. It's quite, that's quite a lot to take on, isn't it?
yeah, it was difficult.
And I know you mentioned there about reaching out to sort of Google searching, but did you immediately get signposting to any help or support at that time?
No.
No.
So I went home, and so there's two things that happened. I went onto Facebook and filed the Childhood Tumour Trust, which had been a brilliant support network. But again, by chance, I happened to be in school on the Monday, and a parent had been at a hospital appointment with her child, and she knew that I was going for a hospital appointment because just general chit chat, and she asked me how it went, and I just broke down, and just by chance she knew another family who had NF1, and I was put in touch with them. So it was kind of, that's how I got support as well,
Well, that was a
through
great
that
bit of
family.
serendipity there. So, I mean, I know Will mentioned some of the skin manifestations, but straight away there, we've also got, audiology, ophthalmology, dermatology, behavioral kind of involvement there as well. So, Mary, what can healthcare professionals do to be a little bit more proactive so they don't have the situation of Sal where all these opportunities are missed? What can they be on the lookout for? And where can they go for information when maybe they're seeing things that could suspect a case so that it doesn't just end up buried in a note and it's progressed forward?
No, definitely. Sal, thank you so much for sharing. Gosh, that's
Mm.
really hard. And I think, we're very thankful that we've got the pediatricians, who are ideally the ones coordinating care. Because, yeah, as you've just mentioned, there's so many different disciplines that are involved in supporting people who have NF1. Yes, it's a condition that causes tumors to grow on the nerves, but as you've mentioned, there's learning problems. There can be bone changes, there can be endocrine, you mentioned about short stature. In my team in London, we're very fortunate to have, even within my office, we've got pediatric nurses, adult nurses, physio, social work, psychology. And I know that's quite rare, and we're quite fortunate for that. Where in the local team, we'd be wanting everyone with NF1 to be under a pediatrician, seeing ophthalmology, every year up to 8, and then, some ophthalmologists keep them on, which is great, but if not, opticians, that they are seeing a geneticist at least once, so they can get the look over, they can get that diagnosis and be offered blood testing, which I know can vary for different regions. So yeah, I would really be wanting people to engage in, like you mentioned, Childhood Tumour Trust. The work they do at raising awareness is amazing, and their website is so helpful. And then there are some other NF charities that we work with as well in the UK and internationally.
And is there a pathway for, obviously, you're kind of a centre of excellence in the UK for this. Is there a pathway for people like Catherine and Sal, for those families to be referred so that there is that opportunity to have coordinated care, or is it very much localised still and
Yeah,
not necessarily coming to
absolutely.
London as a hub?
No, exactly. And unfortunately, as much as we'd love to have every single person in the country, we do not have capacity to do that.
Shame.
So yeah, the complex centres were established, I think, in 2009, just in recognition that, a lot of the complications with NF1 can be managed really well by local teams. Complications such as headache, epilepsy, neurodevelopmental problems, learning differences, behavioral issues. Pediatricians are really good at, managing those things and having local teams who are really familiar with these types of complications, because even if it's being caused by NF, the actual management can be quite the same as someone who doesn't have NF. But there are specific NF1 related physical complications that we really wanted to recognise that they are very difficult. The treatment of them can be really tricky. The thought process around, whether treatment or watch and wait really requires, a specialist team who this is what they do day in, day out. And that's why the complex centres were created. So, for example, my team in London, I think we've got about 2,000 patients that we look after who have NF1. So on a normal week, we'd be seeing about 50 people with NF1 come through our door. So with that, you get that expertise, and we've been doing it for, several decades now, because even before the complex centres were established, we already had a specialist interest. So with that knowledge, we are able to have a lot more ability to get really good results, especially around these larger tumours, especially tumours in the spine and brain, that people can be really worried about. What I think is, the good news is that the majority of people with NF1 do not need to come and see us because they're not going to get those complications. But if they do, or if there is concern about, the potential for complications to happen, we're really happy to receive referrals for us. We're sort of from Manchester down south and into the southwest. We'll receive referrals. In adults, we're a bit different. We'll receive referrals whether you're complex, non-complex. We're happy to receive them, and we'll often see adults as a once-off. Make sure that you've got all the information you need. You're signposted to the right charities, and then you can continue on with your GP, but with the open door that if anything ever came back, we'd see you straight away.
Amazing. And I know that, I don't know if this is a bit of a loaded question, but obviously as Sal's experience of the diagnosis was particularly harsh, that sounds like that was a really difficult time to, and obviously the person that she saw was very definitive, this, with certainty it was NF1. Is that typically what diagnosis looks like, or is there normally, what would that route typically look like? I can see Catherine's definitely saying no, that's not. So, what should a good diagnosis sort of route look like? And then perhaps Catherine, you can jump in as well and tell us a bit about your experience with that.
Yeah, unfortunately, Sal's experience is an experience that we hear a lot, especially for adults. I'm an adult nurse, so often adults who come to our clinic for the first time, this is what they're saying. They've gone through their whole life. Maybe people had said, "Oh yeah, you've got birthmarks. We just have birthmarks in our family," and it's not until they have a child who has a particular complication. Or thankfully, pediatricians are much more aware now, through increased awareness, that people go, "Oh, your child's got all these birthmarks. I think they've got NF1. Do you have any?" And that's when they themselves get diagnosed, and it is, that's such a hard thing to take on. So that is definitely not our ideal.
No.
Our ideal would be that, when people are having their checks, either, when the baby's been born, and some babies are born with CAF-LA patches already. But for some, as they start to develop, that the health visitors would be aware about the CAF-LA patches. They'd be examining their skin. The GPs would be aware, pediatricians, and also schools. We work, our pediatric team works with a lot of our schools to help raise awareness with their teachers and the SEN as well. So yes, that is, again, the Childhood Tumour Trust have done an amazing work at raising awareness, especially with their Red Book campaign, to increase that. Because Sal's experience is not what that's not what we're aiming for.
Catherine, did you want to add something there about Alfred's experience with diagnosis? I could see you were definitely having a reaction to that.
Yeah, I mean, so our situation is quite different in the Alfred has been under medical care since he was 3 weeks old, but for a different issue. So we originally took him to see our GP because he had a cloudy eye. She referred us into our local hospital for some urgent checks, which we now know she suspected could have been retinoblastoma. Thankfully it wasn't, but they then referred us into our local children's hospital for some much more detailed specialist investigation, and they identified glaucoma purely in one eye, which at that age and in one eye was very unusual. And we essentially thought he'd got a poorly eye, and that was it really. And I always say this, thankfully, we met his consultant who was quite sure there was something else going on. So he sent us to see a range of other disciplines within the hospital. And he sort of casually mentioned NF1, you know, I don't want to concern you, but there is this potential. And he said to us that he'd got one other patient who had got a tumour around their eye and essentially was manifesting similar to what Alfred's symptoms appeared to be at that time. So he sent us off to see all these various other specialists for a jigsaw diagnosis, and they all came back and said, no, he hasn't got NF1, he hasn't got any of the symptoms that Will mentioned earlier on. He'd got one cafe au lait patch, he still only has one cafe au lait patch and he's 9 years old. He didn't have any freckling. He doesn't really have much freckling still now. So they were all utterly convinced, and we took that as a win. I'll be honest, we were quite happy with that outcome. But his consultant was utterly convinced. And so he insisted on genetic testing, which eventually, and by this point, we were sort of, coming up to post, he was over a year old. And so we went for genetic testing, which confirmed ultimately that Alfred had got a spontaneous mutation, but we both had not. But unfortunately, the downside there is that we sat and waited for the genetic tests to come back, which takes a while. And we never heard anything, and we were still waiting. And so we were just in one of the routine eye appointments that we were having when his consultant said, well, now we've got the diagnosis of NF1, we can move forward. And I was like, have we? And he was absolutely devastated because, by this point, we saw so much of him that he was like family. And so he was gutted for us that we hadn't had a proper, being informed that what the results were. And I have to say that is literally the only negative point that we have had in this whole journey. Alfred's treatment has been utterly brilliant all the way through. But that particular, that whole period was really challenging. And ultimately, we have benefited from being in a specialist children's hospital with such a wealth of knowledge and information and all the various disciplines since. But that whole period, certainly we definitely didn't have anyone look at us and go, yeah, definitely he's got F1. That was quite the opposite. We almost felt like we were pushing people who were telling us, no, he hasn't, quite a lot of the time. And since then, we have been back to our local hospital. And we actually had a general paediatrician say to us, I don't understand how you've got a diagnosis, because I would never have gone down this pathway at all. Well,
it's great that you've, and we'll come on to that, later about the positives, but it seems that there's a very clear unmet need in terms of that diagnostic experience. Both equally bad situations, and just that makes it all the more difficult to cope with afterwards, doesn't it? So just kind of moving on to sort of the psychological and emotional impacts of that, Catherine. I know that you mentioned that Alfred doesn't necessarily have any outwardly visible skin manifestations, but how important has it been for you to have that kind of psychological support as a result of the diagnosis and the onward journey, and how has that been addressed in a meaningful way?
So Alfred doesn't have the cafe au lait patches that are discussed, and he doesn't have multiple small neurofibromas, but he does have a visible difference because the tumour, he does have a single plexiform neurofibroma that essentially cradles around his eye. So he's had, he's currently awaiting his 10th surgery. So he has had quite a lot of treatment, and he does have a very clear visible difference around that eye. So in terms of psychological, it's a tricky one, really. From our point of view, and from Alfred's, really, we've never known any different. So he's our only child, and essentially we've been in the medical space since he was 3 weeks old. So we do get it a lot where people make comments about, oh, you're all so brave, and I don't know how you cope. And the reality is you don't really have much choice. But I suppose things probably changed for us when out of the blue, I got a message through Facebook actually from a complete stranger who said, "Have you ever heard of the Childhood Tumour Trust?" Which we hadn't. So she suggested that we joined the group, and that changed everything really for us, because we had never met anyone with NF1. I'll be honest, I specifically, I mean, my husband definitely wanted a lot of information, and he sought out information about the condition. I was quite the opposite. I didn't want to know. So I think by finding the group, it probably allowed us both to meet and have conversations with people that were in exactly the same situation. You know, all the families know exactly what we're all going through, because we've all been there in one sense or another. And you just, I suppose, you can't find a sense of community where you can bounce things off one another. People can ask questions. You can all learn from your shared experiences. And certainly for Alfred, the Childhood Tumour Trust does all the various events, and they hold sort of sessions online and things every week. So we do baking, sign language, that kind of thing. And it has allowed him to essentially create this whole group of friends who have all got the same condition. So they all understand, they can talk about, well, I've been to the hospital today, I've had a scan today, you know, this happened to me in school today. And they get it. And I think I can't really underestimate the power of just having a group of people that are all in a similar situation and you've got a shared experience. So definitely that is the number one from my point of view in terms of the psychological coping mechanisms really that have come about for both.
And great for him to have that from such a young age, where he's able to really, because if he gets used to having that kind of dialogue, now that'll put him in good stead as he sort of transitions into his teenage years, where it's, you know, a bit more difficult perhaps to be different and to feel more visibly different. So to have that kind of network of people that really understand him is so important. So it's really great you've managed to establish that with him.
Absolutely. And school, I have to say, his school have been particularly positive. You know, they've really embraced sort of the nature of difference, and they do lots of things proactively. They support the NF Day every year. You know, they've held numerous assemblies. One he did last week where he stood up in front of the whole school to talk to them about NF1. And they are really keen to make sure that it is very inclusive and that it's talked about, which is a real positive. So, you know, in that sense, definitely, I think we are very, very lucky. I appreciate that is not the case for lots of people. And certainly conversations I've had with other families, you know, they really struggle with the nature of sort of parents' advocacy and feeling like it's a constant fight. And that is, you know, that's a challenge that I personally don't feel like we've had to go through as quite so much. But I know that a lot of the other families have done, particularly where there are, I mean, Alfred doesn't have any particular special educational needs, but certainly where that comes into play.
Yeah.
I know a lot of families that really, really struggle with that, and support sometimes can be lacking in those spaces.